when we think about addressing epilepsy, we think about, we want to stop their seizures or reduce them as much as we can, and we want to make sure we do that with the best side effects as possible, right? Minimal or no side effects. But really, a lot of times we also forget about this third piece of quality of life, which is really kind of the patient's perception of how things are going generally within the context of their lives. So yes, their epilepsy, but also things like depression, or how things are going at school or work, how their relationships are they able to drive, are they able to do the things that seem important to them. And so for our patients with intractable epilepsy, a lot of times, especially like the first two things, the keep getting rid of their seizures, that doesn't always work well or go according to plan, and then they often experience a lot of side effects from whatever treatment they're experiencing. And so quality of life, I think, is even more important for these patients, because maybe we can't stop their seizures completely, but we can work on their quality of life. And so completely untreated, we know that increased seizures lead to poorer quality of life. So those with intractable epilepsy, we often see a decline in quality of life based on how long they've had the disease, based on kind of other factors related to their family or their other functioning. But if we can improve their quality of life through either changing the treatment and side effects, or there's psychological treatments we can do, and a Cochrane review that's been done to show that there's things we can do to improve their quality of life outside of just changing their medicine or stopping their seizures. So even if we can't stop their seizures, we can improve their quality of life. Well, some things that we know improve quality of life, we know if we can get their seizures under control, that can help improve quality of life. But we also know things like improving those other areas of their life that medical providers don't always necessarily think of. So if we can, for example, get them hooked up with mental health treatment to address their depression, or if we can get them hooked into social work to help with school or their job, if that's something that's really been stressing them out lately or really impacting their life, we can see improvements in quality of life even if their seizures don't change. We also know that there are specific psychological treatments, some studies that have been done by people at this conference, to improve quality of life through specific things like problem solving, and really focused on either epilepsy specific issues or things outside of epilepsy. We know that sometimes peer support or family support can improve quality of life. In the medical context, if we can get some kind of behavioral health provider like a psychologist, social worker, involved in their medical clinic visit, we see improvements in quality of life. So those are things that already exist, and things that help move the needle on quality of life. Some things I would love to see to improve quality of life kind of above and beyond that are things that are more within the patient's control. So we know that if they feel like they can do something, that alone can increase their quality of life. So I often think about, especially now like with e-health and websites and things like that if we can, those are low cost efforts to really improve quality of life for especially teenagers and adults with epilepsy. And that can really reach people, at top tier medical centers, but also people in really rural areas where there might not be a mental or behavioral health provider, or there's not even an epileptologist around. It's just, their primary care physician caring for them that doesn't even have a lot of expertise with their specific seizures or what's going on with them. So kind of wider audiences.